The cranial nerves, like the spinal nerves, can be classified according to sensory, motor, or mixed anatomical structure. Remember, we said that the dorsal root of the spinal nerves is carrying sensory information, and the ventral root is carrying motor information. And when those two roots come together, just outside of the intervertebral foramen, they join to create that one spinal nerve as it travels out to the periphery. And that spinal nerve then is mixed. It has both sensory and motor components. When we look at the cranial nerves, it's a little bit different. In the cranial nerves, some of them are going to be purely sensory, some of them are going to be purely motor, and some of them are going to be mixed. Remember, sensory fibers or afferent fibers are what are coming in from the periphery into the central nervous system. And when it comes to the sensory cranial nerves, they are beginning with some kind of a receptor in the head or the neck. At least primarily. You'll see that there are a couple of exceptions. And they are sending that sensory information along an afferent pathway, again, primarily into the brainstem. Now, the efferent side of things, the motor fibers that you find in some of the cranial nerves, are beginning in the deep nuclei of the brainstem, again, primarily, and they're traveling out to the periphery. So they're ending up on muscle fibers or glands out in the periphery somewhere. Now, most cranial nerves are connecting the brainstem with either a receptor or an effector cell on an ipsilateral side. Remember, that term ipsilateral means same side, and the term contralateral means opposite side. So for most of the cranial nerves, they are making connections on the same side. The cranial nerve is connecting to a receptor or to an effector cell on the same side of as the nerve, on the left, for example, or on the right. But there are some cranial nerves that are connecting on a contralateral side. So while the nerve may be located on the left, either the receptor or the effector cell is located on the right. That's a contralateral connection, and there are two cranial nerves that do this. One of them is cranial nerve 2, the optic nerve, and one of them is cranial nerve 4, the trochlear nerve. On this slide, there's an awful lot of terminology, but we're not going to learn most of these vocabulary words. I put the image here instead just so we can see this contralateral patterning that we see in cranial nerve 2, or the optic nerve. So what you're looking at here is just a slice through the human brain. These are the eyes, so they were the anterior part of the face is obviously over here, and then the posterior part of the head would be back here. And I want you to think about how your eyes work for a minute, because it helps explain why the optic nerve would have at least partial contralateral anatomy. Remember, the human eye has two jobs to do. It has to receive information and send that information to the central nervous system, and then it has to be able to respond to instructions from the central nervous system in terms of focusing the lens and moving the eyeball and changing the size of the pupil and so on and so on. So the eyes are intended to be used together, both left and right together. They're intended to be open at the same time, and receiving information together. The left eye is capable of receiving information across the visual field, and the right eye is capable of receiving information across the visual field. So both eyes receive a complete set of information about the visual field. So in terms of the optic nerve, about half of the fibers that are coming down that left optic nerve are going to stay ipsilateral, and about half are going to travel contralateral. Same thing is true of the right eye. About half of the fibers in the right optic nerve are going to travel ipsilateral, and about half are going to travel contralateral. So that means after this crisscross point, which we call the optic chiasm, after that crisscross point, these optic tracts are going to both have left and right eye information in them. So both the optic nerve, cranial nerve 2, and the trochlear nerve, cranial nerve 4, have some contralateral components in them. All the rest of the cranial nerves stay ipsilateral. So we need to have an understanding of which cranial nerves are purely sensory, which are purely motor, and which are mixed. I have them broken down at the top of the slide. Cranial nerves 1, 2, and 8 are purely sensory. Cranial nerves 3, 4, 6, and 11, as well as 12, are motor. Cranial nerves 5, 7, 9, and 10 are mixed. Right about now, you might be asking yourself, how in the world do people keep all of this straight? How do people recall not just the names and the numbers of the cranial nerves, but also whether they're sensory, motor, or mixed, and what they do? And the answer is, we use a lot of tricks. We use what are called mnemonic devices, little sayings that we keep in our minds to help us remember things like names and numbers, sensory, motor, mixed, and so on. On this slide, I have just one example of some of the mnemonic devices that people have developed to help them learn cranial nerves when they're taking anatomy. You can see over on the left-hand side of the slide, you've got the names listed of the 12 cranial nerves in order, from cranial nerve 1 to cranial nerve 12. Next to that, over here, you've got one of these mnemonic devices. It says, "On old Olympus, towering tops, a Finn and German viewed some hops." This is probably the oldest saying. I learned this saying when I went through anatomy and physiology. There are more than this. There are more mnemonic sayings than this available to us on the internet. And if you look up mnemonic devices for the cranial nerves, you can find several of them available. And the trick is you want to find one that you find easy to remember. Remember, the way you use a mnemonic device, it varies depending upon what you're trying to remember. But for the cranial nerves, each one of these words, I'm going to pull the first letter from, and then I'm going to associate it with a nerve. So O, 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 T, T, A, F, A, G, and so on. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, and so on. This saying is going to help me remember the names of the of the cranial nerves. But I also need a saying that's going to help me remember which ones are sensory, which ones are motor, and which ones are mixed. And here's another saying to help me do that. This one says, some say marry money, but my brother says bad business to marry money. Again, this one's really old. I don't use this one myself to remember sensory, motor, and mixed. I use a different one that's shown right here. Some say marry money, but my brother says big brains matter more. And for this device, what you do is you take the first letter and you use it to mean either S for sensory, M for motor, or B for both or mixed. So if you can find two mnemonic devices that you like, that you can remember, it will help you make a list of both the names of the nerves, 1 to 12, and whether they're sensory or motor, 1 to 12. That's the really best way that I know to learn these difficult nerves. Now, one thing to note is that among the sensory, motor, and mixed, there are only 4 that are mixed. There are 3 that are sensory, 4 that are mixed, and 5 that are motor. All right, we're going to move on now, and we're going to talk about each individual nerve in terms of what they do. Now, as I said earlier, a lot of times the name of the nerve is going to give you some information. As much as possible, you're going to want to learn what those names translate as. There are 5 nerves that you're just going to have to memorize. There are 5 nerves where the name doesn't give it away. So, olfactory nerve, remember that's sense of smell. That's cranial nerve 1. And if you remember from your saying, depending on what you use for your mnemonic device, this is a sensory nerve. And again, related to the sense of smell. Optic nerve is cranial nerve 2. That's also a sensory nerve, sense of vision. Oculomotor nerve, that's cranial nerve 3. This is the first motor nerve. Oculomotor. This is a motor nerve that's involved in the nervous input to the eye. It's a motor nerve. So the information is coming from the central nervous system, the brain in this case, to the eye, to some structure related to the eye that's going to have an effect. It's an efferent motor nerve. And as it turns out, it controls the muscles that move the eyeball. It controls the muscles that move the iris around the pupil. It controls the muscles that are attached to the lens. It controls the upper eyelid. So all the sorts of structures around the eye that are in motion that help us see, that help our eyes function. Cranial nerve 4 is one of the first ones where the name doesn't give it away. The trochlear nerve. This one also happens to be a motor nerve, and lucky for us, it's kind of easy to remember because it too controls muscles that help move the eye, specifically the eyeball itself. So if you know that the oculomotor nerve is 3, trochlear is 4, and they share a similar function, you can connect trochlear to oculomotor and it will help you remember it. The trigeminal is another one where the name doesn't really give it away. The name does tell us that there are 3 branches because the term tri translates as 3. This is cranial nerve 5, and this nerve has both sensory and motor fibers in it. The trigeminal nerve is supplying both sensory and motor fibers to the face. And the 3 branches are reaching the upper part of the face, the lower part of the face, and the middle of the face. And here are the names: ophthalmic, maxillary, and mandibular. Now, you might see ophthalmic and think eyes, but in the case of the trigeminal nerve, should clue you in that we're talking about the uppermost portions of the face, up where the eyes are. This is the division of the trigeminal nerve that is giving sensory information about touch and temperature and pain sensation in that uppermost region of the face. The maxillary division is giving us, again, touch, temperature, pain information about the middle regions of the face. The mandibular division, touch, temperature, pain from the lowest part of the face, and this is where the motor part comes in. Remember, this nerve has both sensory and motor components. The trigeminal nerve has motor components related to chewing, related to mastication. Cranial Nerve 6 is the abducens nerve. This is a motor nerve, and it controls muscles that move the eyeball. Hey, that's a second one. That's a second cranial nerve with a difficult name that controls muscles that move the eyeball, just like the trochlear. The facial nerve is Cranial Nerve 7. This nerve has both sensory and motor fibers in it. Now, it's easy to get the trigeminal and the facial confused because the facial nerve sounds like it ought to be doing all those things that the trigeminal nerve is doing, but the facial nerve is a little bit different. The facial nerve, like the trigeminal nerve, is both sensory and motor, but it is the primary controller of the facial muscles, and it has a large component in our sense of taste. Cranial Nerve 8 is the Vestibulocochlear nerve. This is a sensory nerve, and like the name suggests, this is about balance, that's vestibulo, and hearing, that's cochlear. The glossopharyngeal nerve is tongue and pharynx. This is Cranial Nerve 9. It has sensory and motor function. It's involved in sense of taste, like the facial nerve is. It's involved in tactile sensations, but not on the face itself, related to the throat area and around on the lateral surfaces near the ears. The motor functions of the glossopharyngeal nerve are related to swallowing and our gagging reflex. Next is the vagus nerve, which is Cranial Nerve 10. The vagus nerve is a fascinating nerve. It gets a slide all to itself. This nerve has both sensory and motor function. And I want you to put a star right next to this information. The vagus nerve is the most extensively distributed cranial nerve. It supplies organs in the head, the neck, most of the viscera in the thoracic cavity, most of the viscera in the abdominal and pelvic cavities. This nerve has a very long reach. It's both sensory and motor. It has sensory function in terms of taste, in terms of thoracic, abdominal, and pelvic viscera sensations, and in terms of sensations in the tongue, in the pharynx, in the larynx, in the epiglottis, and in the outer parts of the ear. Just a tremendous array of sensory function. On the motor side, remember it's hitting all of the viscera. So muscles and glands, smooth muscle and glands, in the tongue, larynx, pharynx, lungs, heart, spleen, liver, digestive tract, kidneys, and ureters. This is a very extensive cranial nerve. The last two nerves are the accessory nerve, which is cranial nerve 11, and the hypoglossal nerve, which is cranial nerve 12. The accessory nerve is the last one that has a difficult name because it doesn't give us a lot of information. It's a motor nerve. It provides motor function for head, neck, and shoulder movements. A little trick that I use to remember the accessory nerve, I think about what accessories are in terms of things like earrings and necklaces and things like that. And we tend to wear our accessories around our head and our neck and our shoulders. If that's helpful at all to you, that might help you remember accessory nerve. Finally, there's the hypoglossal nerve. Remember that term translates as below the tongue. This is a nerve that has motor function and is involved, again, in helping the tongue move. There you have it, cranial nerves 1 to 12. And we need to be familiar with the name, the number, whether it's sensory, motor, or mixed, and what the nerve does.